Good afternoon. Hello, everyone. Hello, ladies around the world. This is the Joys of Living Great. And of course, you know that I'm Faye Horton. I am one of the co-hosts for the Joys of Living Great. I have with me as co-host today, Brenda Sawyer. So we are here with our very special guest today. For the month of October, we are celebrating Breast Cancer Awareness Month. And during this month, we will make every attempt to give you information that can help with any awareness about breast cancers, how breast cancers are being treated now, how you can actually get through a diagnosis of breast cancer and live through it, coming out with that joy that lives within you. This show, through the Win-Win Women Network, is streamed throughout the world. So there are women who can gain information from anything that we share on this broadcast. We're so happy that you chose to join us today. Or if you're watching us as a replay, thank you again for being our audience. Our special guest today is already ready to go to work at her normal clinical position. We have with us today Nurse Andresa Murphy. She is a very, very special guest. She met one of the Joys of Living co-hosts and in a special situation, and certainly encouraged her, even though she was not, the member was not there for a cancer diagnosis. But over the years, she has done a lot of treatment because she is a healthcare worker. I am now going to let Nurse Murphy tell you about herself and what she's done over these years in her clinical area.
Good afternoon. Yes, again, my name is Andresa. I've been practicing as a nurse now for a little over 20 years, mostly in the geriatric setting, but also in the during this pandemic, I've done some traveling, as well as my current position as an assistant nurse manager at Advent Health, heart of Florida. And I worked there on a medical surgical floor, mostly dealing with chest pains and telemetry, heart monitoring, but also we deal with a lot of step down care. So I do end up seeing a lot of cancer patients, and over the years of my nursing experience, I've had several cancer patients as well as family members. And as I was sharing with Janice and the host today, that I also, my oldest sister passed away from breast cancer in July of 2020 during the height of the pandemic. We were not aware of her diagnosis. We did not find out about it until she passed away. And actually, in cleaning her house afterwards, found that she was just about to start her journey with chemotherapy. So it's definitely very near and dear to my heart. In fact, I also was sharing that this year has been probably the first year since then that I've been able to really try to reach out and participate. So this is definitely an honor and a privilege to be able to be here today to share some of my experiences. It definitely, as the host was saying, was not the conventional meeting for myself and Janice. But it's not how you start, it's basically how you end. And we, over the years, have been just, we don't have to talk to each other every single day, but when we do, it's just like we never stop being around each other. So I love her as a spiritual mother, as a mother figure, as a sister figure, as an aunt, as a friend. She just is an all-around person.
Well, that's wonderful. How actually did you and Janice meet? Can you share that with us? How did you actually come to meet Janice, Minister Janice, Elder Janice Denmark?
Yes, Minister Elder, yes, my most definitely. Well, with her permission, because I always wait for her to say so, but she was actually one of my patients. And it was the funniest thing. I don't know if she came in on that Saturday or that Sunday, but I was off and I came to work that Monday and I introduced myself to her and she was like, "Nice to meet you, but I'm leaving today." And I was like, "Huh? No, no, you are not leaving today." She was listing all these, the food is terrible, this is terrible, I'm in pain, I'm this. And I said, "Okay, let's just slow down and take a deep breath and let me start from the top." And I'm telling you, she had her son on his way to come and pick her up. Honestly, she has some of the most obedient children, but I was able to talk her out of it. She finished her therapy, and it's just been wonderful. I'm telling you, like I said, she started out actually just ready to leave, but no, we reconsidered that, and the rest is history. So, but
That's a
yes, ma'am, she was
testimony to
one of my
your,
patients.
that's a testimony to the skills that you have in reaching the patients, because I know that Minister Elder Denmark can make up her mind to do something. And once she's made up her mind, that's what she's going to do. And you were able to dissuade her from making the wrong decision and actually staying at the healthcare facility to complete her therapies. You really have a touch in order to do that. That takes a special person. And then what cements that specialty that you have, it created that bond and that friendship between the two of you, because some people would have really disliked you
Oh,
if
of
you tried
course.
to tell them that they could not do what they thought they wanted to do. So that's a true testimony of the skill and the spirit that you bring to the workplace when you are actually dealing with the patients that you actually work with. So in your personal background, what is it that inspires or motivates you, or what was it that made you choose nursing as your profession?
Well, honestly, my customers at the bank that I worked at out of high school, I went into banking. And my customers over the years started telling me that, "Oh, you treat me so nice. You act like a nurse." And I was like, "I act like a nurse." I said, "Okay," because I never thought about. I always wanted to be a lawyer, and so even I would go to church, and people would say, "Oh, you look like a nurse," and I'm like, "How do you look like a nurse?" So um long story short, that it started like sounding all right. I was like, "Okay, this nursing stuff doesn't sound too bad," but I never would be motivated to take any classes towards it. And the bank that I was working at, the Friday before Christmas in 1997, was robbed. that's how I ended up going back to school. I was a CNA for 3 years. I was an LPN for 13 years, and I was now a registered nurse since 2013. So I took the scenic route with it, but I finally, actually, my customers and the community ministered that to my spirit that I was a nurse. So, and I don't regret it at all. I could not imagine being anything other than a nurse.
Well, it sounds like from what I've heard so far, you actually, that's where you were supposed to be. So I am happy that you found the place where you were supposed to be. And it seems that you're happy being in that place as well. So
I
have
am.
you actually worked specifically with any people who may have been diagnosed with breast cancer?
Yes, I have. I've believe it or not, working in the facility, like Elder Denmark would call it. She all that was her nickname for it, the facility. But working in the skilled nursing homes, um, it has a negative connotation sometimes, but honestly, in nursing, you have to know a little bit of every type of nursing care. Because, yes, I have had several patients who are going through, who have been newly diagnosed with breast cancer and maybe ended up, because sometimes when you take chemotherapy and radiation, it affects other organs, and your bones will sometimes get brittle. And I've had patients who have fallen and broken hips and during their chemotherapy. um, I've had several patients that have had mastectomies, and have, the mastectomy site may have become infected, and they've had to have long-term IV antibiotic therapy. Um, I've also had some patients over the years that have had late diagnosis of breast cancer, and decided not to treat it. And I've seen some of those aggressive forms of breast cancer where you actually can see the tumors outside of the breast. So I definitely, over this span of this 20 plus years, have been in close contact. And also, I have not treated any men with breast cancer, but I do know that it is possible for men as well, not just women, to have diagnosis of breast cancer. So most definitely, I have plenty of experience with having patients in that first part of dealing with the diagnosis at the beginning, middle, and end. So yes, it's
So
very
have
challenging.
you the same, I'm assuming, and tell me if this is right or wrong, the same skills that you use to convince Elder Denmark that she should stay and get her therapies, would those be the same kinds of actions and words and concern that you would have for the patient in any one of those three stages? The initial diagnosis, they're in the middle and they're going through it, or they may have had the mastectomy, but they're not completed with the treatments, or they're having treatments, and then someone who has had the treatments, and so they've completed the treatments. How do you actually, what is it that you personally deliver to them that makes
Um,
them feel like they can do this?
Outside of just the nursing care, I myself try to make the experience be personal. Not every patient, not every person's situation is the same. You cannot treat everybody the same in this with this type of diagnosis. You have to really be in tune to listening, and sometimes that's it. Sometimes just listening to the stories, listening to how a person may have gotten there, listening to them give us advice on what we should do or should not do, um, to maybe avoid some of the situations that they may be going through, or to help us if we ourselves or know someone or have another patient that may be having some issues with it. It is so personal to the person, to the patient. In fact, that is really the model that we are really being taught and studying on, is person-centered care, not just a textbook. Some things are textbook, but every person is different. So where you may say, oh, I need the place to be quiet. Well, no, this patient may want some loud music and may want to just, be very, bright and sunny and things like that. So you just have to really be in tune to listening and being available, not being in a rush to move on and get them out of the way, but you have to really just take the time out and not be judgmental as well to the families. If they may be afraid to talk about it or things like that, we have to just be that listening ear for the patient.
I was going to ask you if you had some tips that you wanted to leave that would help people who may be diagnosed, may become diagnosed, and even people who have already gone through a diagnosis. If you had any tips that you may want to leave, but I think you have definitely left a tip for caregivers and for family in what you've just said. It is important that they understand and be patient enough to realize that every individual is different, and it could be in the same family, but the way one person goes through this type diagnosis can be entirely different from the way another person goes through it. But whatever it takes, the caregiver, the healthcare provider, the family needs to just step back and understand, be patient and understand what is it that's going to help this person get through, and what's going to be the best way to help that person. But do you have any tips that you can give all of us as women for if we're diagnosed, if we have gone through it already? What tips do you have to share with us that will keep our spirits joyous?
I will say from my personal experience, my sister did not tell us, and I talked to her friends, and she did not tell any of her friends. So I honestly would recommend that you do not face that type of diagnosis alone. If you didn't shout it on the mountaintops, I know everybody is not like that, but at least find a confident friend, someone that you can confide in, and so that you will know that you're not alone in dealing with a diagnosis as such. We are still in the middle of a pandemic. We're coming out of a pandemic. So nursing care and doctor's visits, things like that has changed to a certain extent. It's not as isolated as it was at first, but nursing care and going through doctor's visits and things like that can be different than what they used to be. So by all means, share that type of diagnosis with someone, because you I can look back on it and I did see signs of depression and isolation looking back with my sister, and I did not pick up on it. Even being a medical professional, I did not pick up on the fact that she may have been dealing with something as big as this. So please, I just really recommend as a high priority to know that you will not be alone in this. Um, Share, talk to someone, that confide in someone that you really trust, so that you would actually not be dealing with a situation like that by yourself.
That's very good advice. Very good advice. Thank you. We probably have time for one more question to the ladies of the Joys of Living Great and to our Win-Win Women Television Network. Nurse Murray does have to go to work today. So I promised her that I would not keep her. And you see, she told me, she said, I'll be dressed and ready. As soon as we're done, I'll be heading out the door. So we have time for one more question. If someone has a question for Nurse Murray that you'd like to ask, let's ask her so that she can go about caring for those people who are probably now waiting for her. They can't wait for Nurse Murray to come on duty.
Oh, believe me.
I would like to ask a question.
Sure.
Nurse Mary, what can you tell me that you probably haven't said already that would be a great takeaway for today in these times? Like you said, the times has changed with the COVID and how the nursing and people have gotten more caring for people. And maybe even just to be able to focus on some of those things that you were talking about, depression and all that, even within your own family. So what could you possibly like leave with me today to help me out with something like that?
Definitely. Even though the restrictions have been lifted as far as wearing masks in public and things like that, I honestly still recommend that we protect ourselves. I noticed in the height of the pandemic, we weren't dealing with a lot of the infections and things that we usually were dealing with during that time. So believe me, I still recommend that you wear your mask and things like that out in public, hand washing more frequently, or using the hand sanitizers and things like that. But as far as with depression, do not be ashamed to reach out for some help with that, be it spiritual or there are very qualified licensed therapists that will help you. And in fact, because of the pandemic, it's been easier to and cheaper to get assistance with some therapy. And if you have to take some medication, do not feel ashamed to be able to have to do that, because God has given us the ability to use medicine to assist with the putting our chemicals back in balance. So we live in sunny Florida, and people pay thousands of dollars to come and visit us here in Florida. I'm not sure if everyone lives in Florida here, but we have some of the best weather that people, like I said, pay to get out, take a nice walk, sit on your porch if you can. Now it's beautiful weather that we can sit outside, but get you some fresh air. I work nights, so unfortunately, even in my going to my doctor's visits, I was deficient in vitamin D, so I had to have a little boost and taking a supplement of vitamin D. So it is so important to just getting some just regular sunshine. But yes, by all means, they also have little aromatherapies, essential oils that you can even rub on your hands sometimes to help bring a calming experience. Believe me, I have some of it all.
Thanks a
That's so
lot.
nice of you. And you are such a blessed soul to have come to share with us today how you go about doing what you do. And it actually radiates all over you. You're
Thank
such
you.
a wonderful person. I'm
Thank
sure
you.
that everyone who's listening today and everyone who will listen to the replay will understand that you actually do exude that joy that is within you. You
Thank you.
actually, I mean, we can see it.
Praise God.
We can
Praise
really
God.
see it.
Thank
Thank you so, so very much. You've been such an excellent guest, and we
you.
really do appreciate having you. And we may call you back again.
Thank you, Miss Faye.
Oh, you are so welcome. You are so very welcome. Ladies, we are about to wrap up this show, but before we do, I'd just like to let all of our viewers know that this is October, and October is Breast Cancer Awareness Month, and every show this month will be about the joy of survival. The joy of survival while we celebrate and acknowledge Breast Cancer Awareness Month. Our guest next week will be an advocate for breast cancer who has many points to share with us as well. Thank you again, Nurse Murray. Have a
Welcome.
blessed day, week, and keep doing what you're doing.
Thank you.